Director of Ghana Institute of Clinical Genetics, Dr. Ammah Benneh-Akwasi Kuma, has called for a unified national initiative to combat sickle cell disease, emphasizing that success hinges on collaboration among clinicians, researchers, policymakers, patients, and their families. This urgent call was made during a public lecture on August 29, commemorating the 50th anniversary of the Institute's founding, a mission described by Dr. Kuma as a simple, profound commitment to offering hope to those affected by the condition. The event, themed Translating Research into Care, 50 Years of Sickle Cell Excellence, highlighted the Institute's evolution from a research hub to a center for clinical care, training, and advocacy. Dr. Kuma stressed that scientific advancements must translate into tangible benefits for patients, urging that breakthroughs in genetics and treatment be accessible to all. He noted that the true value of the Institute lies in its ability to improve patient outcomes, accelerate early diagnoses, and provide holistic support for families facing the disease. Sickle cell disease remains a critical public health challenge in Ghana, with the Ghana Health Service reporting that 2% of newborns, approximately 15,000 babies annually, are born with the condition. Additionally, about 20% of the population carries the sickle cell trait, placing Ghana among the countries with the highest prevalence globally. Despite progress in research and clinical care, the disease continues to claim lives, particularly among children under 5, due to limited public awareness and inadequate support for affected families. Dr. Kuma underscored that the Institute's 50th anniversary is not merely a celebration of past achievements, but a rallying cry for sustained action. Together, we can build a future where every child born with sickle cell disease receives the best possible care, and where no life is limited by their condition, he said. The article highlights the stark reality of sickle cell disease in Ghana, where the condition affects nearly 15,000 newborns yearly and disproportionately impacts children. While the government has invested in research and healthcare infrastructure, the disease's burden persists due to systemic gaps in awareness, resource allocation, and policy implementation. Critics may question whether the government's role should be more direct in funding research or advocating for patient rights, while supporters argue that public-private partnerships are essential to bridge the gap between scientific discovery and real-world application. The debate underscores the complexity of addressing a genetic disorder that intersects with social, economic, and political factors. As the discussion continues, the article invites readers to reflect on the balance between innovation and accessibility in healthcare, urging them to consider how their own communities can contribute to a more equitable solution.